But for you, you should definitely do what your medical providers are telling you to do. Hi. Hey, I am officially 1 month post ACL surgery. So, I really, to be honest, I'm 6 weeks post, but well, almost 6 weeks. I'm in between 5 weeks and 6 weeks, okay, right there. But I wrote notes because I was supposed to do this a long time ago. Well, about a week and a half ago. Anywho, so week 4, let's talk about that. It was cool. The first day cycling, so I talked about I was going to start cycling. That was painful the first day. But after that, it was real routine. The only thing that at that point and right now that is giving me trouble is my patella, where the graft was harvested. My patella is where my new ACL was made from. So that part that was cut and now is like was sewn back together. That's the only part that's like still a problem. But anyways, I did not. So I said on the last one that I was going to do meditating and journaling. I did not do that right off the bat. I still haven't done the journaling part or the meditating part, like really. But I really want to give this the way that I approach life is very I don't have a good word for it, but serendipity. Like I want it to be peaceful and fluid. I don't want to like you got to do this at this time that I want things to fit and feel organic. So, I mean, I have been listening to affirmations, listening to podcasts, listening to things that feed my soul while I do my physical therapy, kind of grouping those things together so that I can get them done. And that's going to be a lifelong process. I was at a really good place when I fell as far as my mental health and was working on that, and this just kind of pushed into the forefront. And so but it's all a part of the journey and it's all connected, so I will get back to that, you know when I'm supposed to. I'll say that. So on with week 4, I was only wearing my brace at night. um I'm out of my brace because I went to the when I went to physical therapy, uh, when around week 4, I was telling her, like, okay, I try to, because I know how people can be, like they want you to do what they want you to do, but I'm kind of a rule breaker, kind of. So I was just letting her know, hey, uh I'm planning on wearing this brace after you tell me I don't need it because it hurts without the brace. And she's like, oh, it hurts without the brace? That means your muscles are getting weak and they aren't wanting to do their job. Like it hurt even when I'm just laying. My legs literally didn't even want to support me and sitting down and laying down. It wanted the brace to do everything. So I threw that thing. I threw it. I said, oh, psh, well then, we don't need it. It can go. Left it alone. But anyway, I also started incorporating my other leg. I don't have a good leg. I have 2 legs. They're both good. I don't have anything bad. But my non-operative leg, I started incorporating that leg into the workouts because I hadn't really been working it out. And baby, that thing didn't want to lift. I mean, it wanted to lift, but it was getting sore. And I'm like, I can't believe you got the nerve to be getting sore on these easy exercises. But I haven't been doing anything with it because I've been focusing on the other one, and I sure don't want it to get jealous. So baby, I love you too. I love you both equally. Same. But anyway, for week 5, I did not have physical therapy. My schedule and her schedule were not coming together, so I did not have physical therapy that much. But that's great. like I didn't have physical therapy for maybe 10 to 12 days, which I was having it every week. So that was a long stretch. But that was good for me because it gave me the opportunity to kind of get back to relying on myself and my own intuition with my healing. I didn't do anything too crazy, but before I left physical therapy during week 4, she told me not to, that I wasn't good with the one crutch, so to stay with the 2 crutches. I went ahead and still was started practicing with the 1 crutch because I felt like I could. I looked up some things as far as balancing because I really wanted to be able to make sure that leg was supporting. So I was just leaning to one side, putting weight on that leg, this way, that way, to start to put weight on the leg, so to see if it could hold all the weight. And then I was going backwards and forwards with that, and just added some more stuff. She had me doing glute bridges, so I thought it was okay for me to go ahead and do squats because it's kind of this, for me, it's the load is the load, like, so I did it. So it got me back to kind of checking in with my body, and put me back in a more of a leadership position in my recovery, because I was kind of dependent on her to let me know what's what. And I am still, I'm going to consult with her. I respect that she is a professional, but also I respect my intuition and me knowing my body. So I'm going to do a little bit of both. Like, I respect what she can do on the inside, but she was telling me with the incision just was getting drier and drier, flaky, baby. And she was telling me, no, don't put nothing on it. It's fine. And I was like, okay. And then week 4, I started putting grapeseed oil on it. And at night I was putting shea butter on it. I didn't really look up anything or anything like that, but that's just what my leg felt like it needed. And it looked so much better. Okay. I went the other day and she was like, oh, see, I told you. I'm like, you told me. But yeah, I've been putting stuff on it because it needed it, and it's really looks really good because I've been taking care of it the way that my skin needs to be taken care of, because I don't have as much oil in my skin as she does, as she produces. Okay, so I needed to do something different. But anywho, let's talk about week 5. So that's what I did. We talked about week 5. That's what I was doing. And I had some goals for myself. And I did some of them. Let's just talk about them. I'm going to go through it. So, okay, I had to check. So, yes, my goal, which I'm so happy to see, was to start to get, by the next time I went to PT, I wanted to be able to start practicing without crutches. And I'm happy to say that yesterday was my first day back after the 10 to 12 days off from physical therapy. And I was walking without my crutches. I practiced without my crutches. And I was walking this morning without my crutches here in the house by myself, doing a little strut back and forth. I'm going to call it a strut. It might not been a strut to nobody else, but for me, it was a strut. And so I walk in, I got my crutches a little bit, but I can walk without them. I can get from point A to point B without them. And I'll be 6 weeks Thursday. Today's Saturday, if that matters to you. But you listen. It don't take everybody that long. Okay, the young folks, it don't take them that long. It may take people longer, but it all happened in its time. And crazy thing, I was tripping like, oh my God, I'm not able to walk, and it's been 4 weeks. Things happen when they happen, and it's so crazy to me because I'm of the mindset, like when I was potty training my kids, I'm like, they're not gonna wet the bed for the rest of their life. They're not gonna want to sleep in the bed with me for the rest of their life. This is something that will pass. It doesn't matter when it passes, it's going to happen. But I wasn't thinking about that. I didn't think about, now that it happened, I can look at it and say, oh, this is the same kind of thing. Girl, it doesn't really matter, if you get it early, late, in the middle, whatever, as long as it happens. And I'm moving right along, and I'm really really excited about that. So I said that I was gonna continue to work on the meditation, and I wake up like 2 hours early anyway. And maybe me saying it on here will help me to do it. But I wake up early. I always wake up before my alarm clock. So there's no reason that I couldn't take some time to meditate, then write some things down in my phone to just make it easier for me. I love pen and paper, but it just may make it easier, or put pen and paper by my bed so I can just make that a part of my routine. It's kind of a little different now because the sun doesn't come out tomorrow. The sun doesn't come out as early because daylight savings time just happened. So that kind of, it throws me off. But I could, of course, do it on my phone instead of just writing it down, and that is enough for right now. That works for right now to move forward with that, if that is something that I want to do, and that I want to make a priority. And I'll just go with the flow on how I feel and how much I can get that done. But that, I feel like, is a tool or a way to get it done. So I'm gonna work on that. Practicing outside with one crutch 2 to 4 days. That was my second goal for this past week, and I did that. And I said, it might be kind of dangerous because she told me not to, but I already made the decision and I did it, and I survived. Now, I'm not telling you to do that. If you have an ACL injury, you should listen to your doctor, because I'm not giving you any advice. I'm a nurse, but I don't give medical advice. Okay. So, but for me and my body, I wanted to do it, so I did it, and that it worked out. I felt strong enough to do so. I walked down the stairs with two crutches. Of course, I'm still on two crutches up and down the stairs, but I did try a little something when I was just coming up the stairs right now, that worked for me before ACL surgery when I was trying to get back to stair, like regular stair stuff. So I tried, so with crutches and stairs, you lead with your, they said, bad, they use these terms. Don't listen, leg, because I'm not talking about you. I'm talking about what they said. They said bad leg to bad leg down, and then your good leg when you're coming up, you lead with. So I tried leading with my operated leg, my baby. It's not, no, I don't have no bad leg, but my operated leg, I started with that one up one stair, and it worked. I mean, it was a little pain there, but when the pain passes, if you have pain and it's just right then and then it goes away, you don't worry about it. That's the name of this game. So, that was it. Um, so yeah, I'm gonna probably try to practice those a little bit more and more as it goes on, but I don't know. I'll see how I feel. Check in with myself and check in with my physical therapist. I go back to her Monday, and I'll run it by her. Like, I run it by her after I done it, but still I'm running by her. Like, I had started doing like a little baby squat, and she was like, I don't recommend squats this early. And so I said, okay. And she said, but I could do wall squats. So I'm gonna do the wall squats. Now, today I did do a deadlift with just like 25 pounds. Okay. And she didn't tell me to do that either. But I'm gonna check in with her Monday and see what she say. But I did it, but we'll see what she say. Cause she did start me on, okay, so she opened up that gate when she had me on the I didn't tell y'all this. First I did squat rack yesterday. Not squat rack, lied. I did leg press yesterday. That quad thing, the hamstring curl. Okay, that's what's called. What's this called? I don't know. Extension, leg extension, press, no, extension. And then I did a hamstring curls. And so I'm excited. I feel like, so she opened that door, and I just opened it a little bit further, went inside a little bit because she had already opened the door. So I'm gonna go in. That's how I do it. But I'm gonna ask her, it's better to ask for forgiveness than permission, especially with my own body. But for you, you should definitely do what your medical providers are telling you to do. Definitely. Um, if you want to. I don't know. But I felt strong enough to do it. And then so I did also put on there that I was going to do 2 to 3 days of upper body weightlifting. I did not do that, but definitely this week I'm going to be working on it because I got to be down there anyway, working on my other stuff. Like, I need to do my deadlifts until she tells me not to. My wall sits. I want to start using more of those. She introduced weights. So now weights are, they're fair game. So I'm doing it. I'm not doing anything crazy. And people will be like, yeah, because I know people may think I'm doing something crazy. But please, listen. ACL is responsible for twists and turns, sharp movements. So as long as I'm on this plane, going back and forth, up and down, I am not bothering it. I'm not doing anything, okay? And as long as it's not too much weight, I am not doing anything. I'm trying to get these muscles back in business, and so we can go further, okay? Because if this happened to me again, okay? So, I'm going for it. That's that. But yeah, and I said 15 to 20 minutes on the cycle bike. I think I did 10 to 15 today, And so I will work on that 15 to 20. So, let's wrap this up. 1, I am going to be working on my spiritual and emotional health by journaling and spending quiet time. Let's not even go as far as to call it meditation. Spending more quiet time without a phone, without talking to somebody, just me and myself spending time. That is what I'm going to do for that. Practicing outside. She wants me to practice. She said that I could practice with no crutches in the house. So I'm going to focus on that. I am going to go outside and practice with no crutches with my brace, but it's hard with that brace. I do not like that brace, but I do still have to wear, I don't know if I mentioned, I do still have to wear the brace when I'm outside. So I don't even know where it's at this point because I'm not fooling with it like that. But when I go outside, I'll have it on. So I don't even know if it's worth me practicing outside, but I'm gonna definitely practice every day without crutches, so that when she see me on Monday, which that's only like 2 days away, she may take me off of them, but I'll still be practicing. That's gonna be, my whole life is gonna be practicing walking. So but that is a goal for right now. Yeah, and doing a little bit of the stairs with my operated leg first, just to start getting that pattern down. And then I am going to do 2 days, at least 2 days of upper body lifting. So I'm going to start a linear program for my upper body because I'm going to let them have the legs, the lower body. I'm going to let them have it for now. The physical therapy in them. I'm going to follow their lead. But I can do some upper body. I can do some core exercises. I can always do a 5, 10, 15, possibly 20-minute ab thing on YouTube. So I just need to fit that in. And I need to do a linear program of bench press, overhead press, maybe put some curls or whatever in there. I need to start that. I need to start that. Not necessarily, let's go back. Don't need, but it's time. I want to. And so that's what I'm going to do. And yeah, along with that will be my moving towards 15 to 20 minutes of cycling. And it's going to happen two or more days a week because I might get into a flow where I can do it more often. I'm typically work out before this happened. I only work out in the morning. I'm never a person to work out in the evening, but now I have to do physical therapy twice a day, and it happens in the morning and the evening. So that has opened a door for me to do some evening things. So I may have a chance with my work schedule to still be able to do, I can do 15 minutes on the cycle bike. I can, but do we know if I will? That's what we're trying to figure out. So yeah, that's the update. Going into week 6. 1 month. It's been over a month. Over a month. I can walk. Not very good, but I can walk. And that is progress. I'll take it. All right, have a great day. I hope you have a great week.